The medical technology keeping you alive has secrets that doctors rarely explain, and some of these machines are doing things you'd never expect. Let's start with MRI machines, because what's happening inside that tube is borderline science fiction. MRI stands for magnetic resonance imaging, and that magnet is insanely powerful, 60,000 times stronger than Earth's magnetic field. When you're inside, that magnet aligns all the hydrogen atoms in your body in the same direction. Then the machine hits you with radio waves that knock those atoms out of alignment. When the radio waves stop, the atoms snap back into place and release energy. Different tissues release energy at different rates. Fat responds differently than water, bone differently than muscle. The machine measures these tiny energy releases and converts them into images. Here's what they don't tell you. The MRI is always on. That massive magnet never turns off. It's energized 24/7, which is why there are horror stories of metal objects flying across the room into the machine. Oxygen tanks, IV poles, hairpins, belt buckles, anything ferromagnetic becomes a missile. People have died from metal objects pulled into MRI machines. That's why the screening process is so intense. One patient forgot about a metallic tattoo and suffered severe burns because the metal in the ink heated up from the magnetic field. MRI machines are loud because of the magnetic coils rapidly expanding and contracting. They're physically vibrating at frequencies that create banging, knocking sounds up to 120 decibels. You're not hearing the magnet itself. You're hearing the structure responding to the massive electromagnetic forces. Now let's talk about ventilators, because the rules around them are stranger than most people realize. A ventilator breathes for you when you can't breathe on your own. But here's the catch. Being on a ventilator damages your lungs. The pressure required to inflate your lungs mechanically causes something called ventilator-induced lung injury. The longer you're on it, the worse the damage. That's why doctors try to get patients off ventilators as fast as possible. But there's a darker secret. Once you're intubated and on a ventilator, weaning you off becomes incredibly complex. Your body adapts to having a machine breathe for you. Your respiratory muscles weaken. Your brain's drive to breathe diminishes. Patients can become ventilator dependent, unable to breathe effectively on their own even after the original problem is resolved. Here's something that'll surprise you. Ventilators can be set to let you fight them or work with them. When you're sedated, the machine does all the work. As you wake up, the settings change to assist your breathing efforts rather than override them. But if you're awake and fighting the ventilator, trying to breathe out when it's pushing air in, that's dangerous. Your oxygen levels drop, your heart rate spikes, and you can cause a pneumothorax, a collapsed lung. That's why patients on ventilators are often heavily sedated. If you're discovering how medical technology really works, hit subscribe. We're revealing the secrets behind the machines that save lives. Let's bust some hospital tech myths that even medical staff sometimes believe. Myth number 1. Hospital heart monitors can predict a heart attack before it happens. They can't. They detect heart attacks in progress by measuring electrical activity and rhythm, but they can't predict future events. What looks like a warning is usually already the beginning of a cardiac event. Myth number 2. Those finger pulse oximeters are perfectly accurate. They're not. They measure oxygen saturation by shining light through your finger and measuring how much is absorbed by oxygenated versus deoxygenated blood. But nail polish, cold fingers, dark skin pigmentation, and poor circulation all affect accuracy. Studies have shown that pulse oximeters can overestimate oxygen levels in patients with darker skin by up to 5%, which means some patients are more hypoxic than the machine indicates. Myth number 3. Defibrillators restart stopped hearts. They don't. Defibrillators stop dangerously irregular heart rhythms, fibrillation, by delivering a massive electrical shock that essentially resets the heart's electrical system. If your heart has completely stopped, a defibrillator won't restart it. That's why CPR is so important. CPR manually pumps blood to keep oxygen flowing to the brain and organs until the heart can be restarted through other means. Here's a secret about CT scanners that should concern everyone. One CT scan delivers as much radiation as 200 chest X-rays. CT scans use X-rays to create detailed cross-sectional images of your body, but the radiation dose is substantial. Repeated CT scans increase cancer risk. The medical community knows this, which is why doctors are supposed to justify every CT scan and consider alternatives. But in emergency departments, CT scans are often ordered liberally because they're fast and provide definitive answers. The machines even have settings for radiation dose. Lower doses mean grainier images but less radiation. Higher doses mean clearer images but more radiation exposure. The radiologist makes this call based on what they're looking for and how critical image quality is. But here's what patients don't know. You can request dose reduction. For routine scans where ultra-high resolution isn't critical, lower dose protocols can significantly reduce your radiation exposure. Let's talk about ultrasound because it's the most misunderstood imaging technology. Ultrasound uses sound waves, high-frequency sound that humans can't hear. The machine sends sound waves into your body. They bounce off tissues and return to the transducer. Different tissues reflect sound waves differently, creating an image. It's completely safe, no radiation, which is why it's used for pregnancy imaging. But here's the secret. Ultrasound is operator-dependent. The quality of the image depends entirely on the skill of the person holding the transducer. They need to know anatomy, understand what they're looking at, and manipulate the probe to get the right angles. A skilled sonographer can see things that others miss. An inexperienced one might miss critical findings. Here's something about surgical robots that hospitals don't advertise. The robot isn't performing surgery. The surgeon is. The Debunking surgical system and similar robots are tools controlled by a surgeon sitting at a console. The robot translates the surgeon's hand movements into precise micro-movements of surgical instruments inside your body. The benefit is smaller incisions, less blood loss, and faster recovery. But the robot doesn't make decisions. It's an incredibly sophisticated remote control system, and the surgeon's skill still determines the outcome. Here's where it gets controversial. Hospitals market robotic surgery as superior, but studies show that for many procedures, outcomes are the same as traditional surgery. The robot benefits the surgeon. Better visualization, steadier instruments, less fatigue. But whether it benefits the patient depends on the procedure and the surgeon's experience. Hospitals invest millions in these robots and need to justify the cost, so they're heavily marketed to patients. Let's talk about something nobody explains: hospital monitors and their alarms. Those machines monitoring your heart rate, blood pressure, oxygen levels, and breathing are hypersensitive by design. They alarm constantly. A nurse moves your arm and the blood pressure cuff loses contact. Alarm. You shift in bed and the pulse oximeter slips. Alarm. This creates alarm fatigue. Staff become desensitized to alarms because 85 to 99% are false alarms or clinically insignificant. But here's the danger: that remaining 1 to 15% includes real emergencies. A genuinely dangerous heart rhythm can be missed because it sounds like the 100 false alarms that came before it. Hospitals are aware of this problem and are working on smarter alarm systems, but right now, it's a real patient safety issue. If this is changing how you see medical technology, make sure you're subscribed. We're breaking down the truth behind the machines and myths in healthcare. Here's a final secret about medical technology. Most of it is designed for average-sized adults. Medical devices, drug dosing calculations, diagnostic criteria. They're all based on studies done primarily on average-sized men. If you're a child, elderly, obese, very tall, very short, or female, the technology might not work as accurately for you. Pulse oximeters are less accurate on small fingers. Blood pressure cuffs give false readings if they're the wrong size for your arm. Even diagnostic criteria for heart attacks were developed based on male physiology, which is why women's heart attacks are often missed. They present differently. Medical technology is incredible. It saves millions of lives, but it's not infallible. It's not always as advanced as hospitals market it, and understanding how it actually works helps you advocate for better care. Those machines monitoring you, imaging you, breathing for you, they're tools operated by humans, and both the machines and the humans have limitations. Next time you're in a hospital surrounded by beeping monitors and high-tech equipment, remember, the technology is impressive, but understanding its capabilities and limitations might just save your life.